Now the 17th day of February 2021. Inside 2018, presidentbio be make an unannounced visit at Cottage Hospital. E be learn beaucoup tin them about Cottage. We be make it tell we say in heart not glady the way we meet the hospital. Okay. This na 2021. Anything change from that 10 day? Well, maybe little, maybe not, maybe major. But we can learn about waiting they go on right now na Cottage Hospital. Okay? But before that, make I give you the status update for COVID-19 na Salon for today. The labs them be analyze 391 tests. 391 tests. And the labs they analyze. Out of that 391 day, nobody not test positive. Again, now yeah, I'm yet to see the day without that lockdown we been get from Western area for going to the provinces, we will get over 1,000 tests being done again inside Salon. Without that, I'm not suicide one day possible. Okay? But let's continue. 0. Nobody not test positive. So because of that, we still get 3,825 people who don't test positive in Sierra Leone. For the past 24 hours, nobody not lost in life to COVID. So still stand at 79. The one who in isolation, 1,154. For the past 24 hours, 7 people be recover from COVID-19. And so we get a total number of 2,592. The one who in quarantine, 198. Imagine before, like we get people in isolation, when at 1,154, the number I low for people in quarantine, that one they go past 1,000. When they contact tracers, then they do the work proper one. They pass 1,000 people. But we get 1,154 people in isolation. We only get 198 people in quarantine. Then 2 number then they. Me on triple. I say Let's continue, yeah? The other done discharged from quarantine now 14,303. Let's check Mano River Union countries them. Sierra Leone 0. I can be telling you just now. Guinea 53. Liberia 0. And then they get their own game. Ivory Coast 130. That one day, now give you a total number of 183 people will test positive na the Mano River Union countries them for today. The cumulative death, Sierra Leone na 79, Guinea na 85, Liberia na 85, Ivory Coast na 179. Yesterday, Ivory Coast na be 174. So within 24 hours, Ivory Coast done lost 5 people to COVID-19. The rate at which then they test positive, Then they now 179. Now when they don't give you a total number of 428 people where we don't lost to COVID-19 and the Marino River Union countries them combined. NACOVAC don't review the COVID-19 restrictions. Yeah? Before this review, Chef, people let me don't take now they ask NACOVAC questions. Say wait to NACOVAC. Do ya why una still put coffee order? Where it be say the western area lockdown una begin una don't pull her. So waiting at the reason for coffee order? If lockdown self no day again for come out at the western area and for going to the provinces. Waiting una want for achieve. Okay. We don't know if now because of them few people that ask question, I make NACOVAC change their mind. But NACOVAC say they don't review. And this now the current revised COVID-19 restriction na salon. Number 1. The nationwide curfew now from midnight to 5 a.m. You know say before now from 10 p.m. where they make people and they rush. They say time for transport. We cannot reach that 8 o'clock, 9 o'clock. If you see where people and they choke. They say all I want they serve the help now for spread because we thing do. All man they run for catch the coffee and make it no meet and a treat. So now they don't care and go to midnight. Okay. I will see still if people and go begin to run again, they choke say, if you know they work the net, and if you know to an emergency, 12 minutes is still in a treat. No, passive 14, then people and be they call night carpenter. If you're a night carpenter. Even the night carpenters, if that's too early for them for come out. That's also. Okay. Bars, number 2. The bar there and the restaurant. Remember, let me tell them say Friday, Saturday, Sunday, bar and restaurant. Na no go. But now, the bar and restaurant, they don't permit them for operate every day outside of curfew hours. But they expect them for shutdown in ample time against the curfew. We mean say that Friday, Saturday, Sunday again, no day. No day again. Now they can sell from Sunday to Sunday or Monday to Monday, Tuesday to Tuesday. How they choose for do am. But then go able do am no more. We coffee no day. But who that one go dey na bar safety coffee other time. Pastor day want spend the night too. Maybe he choose for do an all night. An all night of waiting. Papa God help we. But anyway, for say you for shut down harmful time, then they left and give you. Well, if na usa you buy day, na day you day, you left to your customer there now. If na usa your restaurant na day you tap, you left to your customer. But they not give you time more, then say harmful time. Let you use that you think within a way correct. And say make you use them for close so that coffee order no go and bug you or your customer them. And shall strictly adhere to COVID-19 rules and regulations. Okay? Then say at least one hand washing station with clean water and soap for them at the entrance of the venue at all times. NACOVAC, I know you. Because we not talk about water and soap. What about the tissue for dry the hand? The tissue for dry the hand, mix? Alright. Anyway, me I want add for say at least one hand washing station with clean water, soap, and tissue. Because they get for dry the hands there. Unless if they want for whip and back and then close, then wait till make you wash and then go wash and back. Whip and I close, go wash and back. I think we try you go find tissue. Eh? Staff and customer them for wear face mask correctly when they know they eat or they know they drink. If you know they eat, if you know they drink, you dey inside restaurant, you for wear your face mask. And then say if I wear them back correctly. Eh? And then for also observe physical distancing. And for observe them. Alright. Number 3, clubs remain banned. Bars and restaurants can operate, but then they operate normal. They not give them pass for coffee. Okay? But clubs them, that one day, it ban. Number 4, mandatory wearing of face mask in public spaces and public transportation will be strictly enforced. You don't tell they hear this. When they say public spaces, you don't see who side and left loophole now for like waiting that officer be doing alumni. Mandatory wearing of face mask in public spaces. Which space? Na street? Na public office? Which one are the public space? Who side and call public space? Are you front entrance? Now the club now you entrance? Who sign a public space? Alright too. Now not to show them be put out. Now they don't chook this inside it. But then go need for clarify. Anyway, let's continue. Then say by force you for wear face mask na public spaces. Public transportation. Because waiting do, then go enforce her by force. Are they doing it? Meh. Let's go. Number 5. Places of worship. Then go remain for all and service for not more than 1 hour 30 minutes, 190 minutes. And if they want to do another service, then go for clean properly before the other one. Sporting activities then go only be conducted na the National Sport Authority announced venues. Yeah, we're getting there. Salute. National Sports Authority announced venues. And with waiting, no spectators. With no spectators. Alright. Number 7. All the public meeting them and activities them, whether ministries, then departments, and them agencies then of government, as well as the one them way not to government people them. Then go do, make them not forget say COVID-19 prevention messages and compliance. Then for strictly adhere. If not, then go make them do them by force. NACOVAC they urge the public for remain vigilant as still them believe say transmission of COVID-19 in us alone. They say that we all observe the safety protocols for keep we safe and we family and we community safe. Remember, Corona fet, now we all fet. Solomon Jamiru Esquire, spokesperson, NACOVAC. This now the updated or the revised restriction. Alright. That one for that public space, and we need for clarify small. Because if not to that, I think say wahala go there because officer there. Hey play, they want their own for common. Not to the country, you know, not to NACOVAC, you know. I say their own. Alright. Let's come to a program proper for today. We learn say, because it's still happening. Water, not the, not the Oladio in PCMH hospital. you know, say, when they say cottage hospital, mostly, na the woman then they go born. Na they carry them picking and go. Yeah? But before I come with waiting they go on there right now, I want for refresh remind August 27 now be on a Monday 2018. Remember, presidentbio we just take office inside April. The swearing in be happen April 4th. Okay? He just take office. The handing over was May 12th, I believe, because I was in Sierra Leone. May 12th, 2018. Then after that, the president begin to do the unannounced visits there. So now I grab this Monday morning, no. August 27th, 2018. He said making just bust for them. Na cottage hospital. There, make I refresh your mind back. Waiting be happen that thing. They say, presidentbio, he just bust for them na cottage hospital. For check the condition of the patient, listen no, and see if health workers then they comply with the 8:30 report time. Wait for go work 8:30. But he say him be go check on the patient then condition. The 27th of August 2018. During the tour na the facility where they host the Oladirin Children's Hospital na Frobe Road, na the eastern part of Riton, the president noticed say one of the matrons not be there in his seat. Waiting again, one of the matron not be there in his seat after the clocking time for all public workers them. The president began for turn to the doctor where they in charge. And he be ask him, waiting at the reason for the matron in absence. He say, make sure say he follow up that and an urgent action for be taken for enforce the recent measures for all government workers. Remember back na be 2018. After the president don't inspect the different side them, it be express dissatisfaction over conditions at the hospital. Hey, Papa God. I will be left for ask the president right now. Is he still dissatisfied from that 10 day to now? What has he done? And then he ask the Minister of Health and Sanitation out. Then he gam for make you go na the tertiary side. Or no to that. We don't know. But 2018, it tell we say dissatisfied with the condition na the hospital. And he also say the facility be too overcrowded. 2018. 2021. What the president don't do for make it not become overcrowded again as it used to be. And he say the hygiene situation need urgent attention. Maybe the president don't forget about these visits. That's why I went back to the archive for just remind them. Say make you not forget to. Now the thing then this, where he been talk, where he go na cottage hospital. Because what's going on right now, I can make the president know. Just in case himself not know, I don't know if he go be shocked with waiting I get for say. But I hope say if he get for be shocked, let be saying a high power voltage. So tomorrow morning, he not go forget. The hygiene situation is say need urgent attention. He, however, tell thank you to the health workers the way be meet for say Then health workers then are patriots. And he recognize them because then go work on time. In terms of the turnout, the president say, we for be happy because he meet a doctor where he be good at attending. And left yonder. Look on to the side way now that one can talk about. On the deplorable state of the health facility, the president say, I am not pleased with this place. And not gladly with Cottage Hospital. He say, na ya people and they can born picking them. And this place, not fine. 2018 August, presidentbio. He say, him be do yeri boku. But this place, now he make him decide for good day. And he don't go see for himself. This facility is not enough for the woman them where they come here for come born. I don't see him. And now the government in own business for say we improve and help save lives of we compatriots them. It's nice to remind the president of Sierra Leone saying that then what there he been tell we when he been go na Cottage Hospital 2018, 27th of August. Just in case he don't forget. Because I know say beaucoup thing then day where they can have the president in table, where they can have in mind. But if 2018 presidentbio you be dissatisfied for Cottage Hospital, you can imagine how it turn now, sir. Maybe one of them days here, please, I'll make you pay an unannounced visit back. Make you go there. Because things then they, well, I'm bringing your attention to now. Then then be the 2018 cottage where you been visit. Now, sir, make I show you waiting they happen na the 2021 Cottage Hospital. Number 1, sir. Water nodi. Water na life. How we go get hospital? Just imagine waiting we mama then get for go through for born. Then na that same hospital we talk about no get water. You wanna know how awful it be? Okay. Imona this person. He not able for beer. He say this. He say water no dey na the major maternal referral center inside Sierra Leone. He say 1 year ago, that's the last time we be visit today. Now a doctor anyway, we can give him time where he go na salon. He say 1 year ago, na be the same struggle. Where him be left. He say he don't come back na cottage. Na the same issue. He say what would they do? This is stupid, she says. And Nyanda, he tag Ministry of Health and Sanitation, and he also tag Guma. They call them out. Yeah? Okay. We don't go mulandi. I come back. He say, wait to PCMH. This na day 4. That's another time. Oh. This na day 4. Why would they preach about say we dey for maternal and all the mortality business, but water no dey na the hospital? This ain't alright. Okay? And after 4 days, And not only week 1. Listen, some are going to be graphic, but I think the president need for yeri. They want to okay, listen, where they go tell the pa, una need for yeri. And this one, they come out from Dr. Catherine Jackson Cole. Go on Twitter, watch for him. You go see and he say he get a patient with the bleed. The only speculum in use, now the OPD, was so disgusting to even look at. Yeah? That when the doctor, he refuse for use them per poor unsuspecting lady. Yeah? Doctor we come or us friend then go can break the tear down for we. But woman the way they understand waiting at the talk about. Waiting the speculum they do. Now one, the one green one we didn't get at the hospital. We in look at a normal, it is disgusting. Let alone for taker, for put and purposing. Day 5, that now be day 5. He say water no day. Now packet water. Now then they use for scrub na the theater. Yes? He repeats and yes, packet water. The packet water then they go buy na ticket. For can scrub na theater. The doctor gets tired and he take to Twitter. So Vicky Yomu go catch and small. He say, tell me small ba. Say because myself, anything I can do story and so it can be. Yeah? This now waiting he say. He say, Ataya. PCMH, from thy kingdom come, water no didi. He say, bo, water de over the streets. We will go up na Frobe Road, na that area there. We not say even street pump be there, then send them there. He say, water de over the streets, because pump then na they host within na Frobe Road. Water de over the street, but water not there na the hospital. Last year, na packet water now will be the use for scrub na the theater. This year, same. No left and day. You sabi you gain what do you want game? Yeah. How we go to talk about maternal mortality? This past weekend, he say girls, no in na the hospital, girls. Yeah? Not too long ago, President go launch how many $1 million hospital? This na outside where mama then they go for go born. Girls not in at the hospital. This na the same hospital where the president be tell you about 2018. I don't know if now this time be tell them, but Mr. President, I they bring to your attention now the 2021 Cottage Hospital. Girls safe, no dey. He says so pele woman come safe na void. Until you understand what in that minute or so, they not go able help am. He said the speculum safe where you want use them. Where in be want use for one lady, that one what I tell you about just now. For one lady, and he be want use them for the lady because what do? He said the lady be the bleed. He said, but he not get mind for put them inside the person. Listen, no, waiting pathetic na ya how we people them they tot sick na salon. He said they not they sterilize them. He said doka na soap and water and put them inside the next woman. And so then they do. Soap and water, put them inside the next person. Then not they sterilize them. And a 1 grain, 9 then gets. Are you listening, somebody? The pan yai. The pan yes. The one that they listen. I open at the yeri. So infection na this place. This thing in mona. When you talk, then you go receive call from upstairs. With all the thing where they go through. It say when you talk, you go receive call from upstairs. Is that right? Right? For receive call from upstairs because you question. Who is going to speak up for our mothers? Who is going to speak up for we mama them, we sister them, we auntie them? Because the nurses, the doctors, they're not happy. But then they're afraid. If they let them go, how you going to hire them? You go hire them? Now so it for be? Are we paying attention here? Are we? Let it sink first for a little while. Let it sink first for a little while. And you go get the vuvuzela them. Where they blow. One thing about we government in Sierra Leone, the basic, now they not care about. They not get that for member. Big. They are no mixed in there. The basic, no. Then they look for the big things. Yeah? Then they look for the big things, and then they look for. Wait for make hala with. Because if they go put water under now, we go ask them say, una for be done put a long time ago. So they no say that one day, it go look more na small. So now I make them just left down the shuffle. But when they go say then they launch how many $1 million this, how many $1 million that. 9 people and they run with. You know they see. But the basic thing we need, like the hospital, forget water, forget gauze, forget gloves, forget all these things. No. But they launch how many $1 million hospital? Do we need that? Yes, we do. So if I abandon this one, no, we should not. Okay. I did tell you, say, if you want to see something happen, yeah? Yeah. If you want to see something happen, go on Twitter. I'm telling you. So, when this thing they go on Twitter, now ain't somebody from Guma go tweet say, oh, they don't go supply water na the hospital. Just because of waiting. The thing begin cause, and it go damage the reputation of this administration. They know that. But my dear, you think say, now then be care and go? Hold on, make I give you the update on that one. The only operating theater then supply them 2 drums of 5,000 liters. When at 10,000 liters. We pour 3 police na me get. The rest of the hospital no get water. So the water where they carry go, we even not to them carry and go, but go can down that side. The people, the good at people them, we carry this water go. The good at people them, we think say them for carry the water go. Now then they able for provide 10,000 liters 5,000 liter. And then feel say, na the theater na go really need them. At that time, who want to be in a theater with no water? They did well. Kudos to them. Kudos to them. Now, CUAM, CUAMM, now an NGO support group within a PCMH hospital. Now then go with the water. So this one where the person go make ala for saying that they care water. Not to they even care water. Now an NGO support group. All till we able pa other people and for do and for we. So pass NGO then. Now then can supply the water. Don't in grab na go talk and say now then supply. But the water say for the supply, not just for the theater. The rest of the hospital no get water. The wards them no get water. OPD no get water. How pregnant woman them for worse? How then go flush the toilets them after they don't use them? He say, in go for go use the bathroom. No water no dey for flush. He say the kind way emit the kind smell. In just commodity. 5 years ago, this problem who they talk about, it be still the day. He say 5 years on, we still they talk about the same problem at the same hospital. No wonder. With a loss, that MCC, the ala say we win, but the healthcare, the maternal healthcare, we lose them, we fail. But this administration don't even care about whose side we fail. They only care about whose side we win. So they're not even talking about how to build up this. Because when they come, when they go in the back, they meet up that thing, they fail them over and over, but they don't care. Because waiting they say we pass 13 out of. But the one they will fail, now the one they will for make the lives of the human development where the president they talk about be a better one. Now the lives of the human development. If you know they're alive, how you go develop? Now the one they do they fail, will they pass corruption, will they pass this, will they pass that? But the one they will for make we better, the one they will for make we get well body, will they fail them? From where they talk about the MCC scorecard, instead there you didn't talk about the one they would fail. You know you didn't talk about huh? Yeah, we you make a know, yeah? He say no wonder we make could fail them as compared to like Ghana, Nigeria. At least we will get there. We know we go able for do number 1, number 2, and flush the toilet. He say and refuse for back down on this one when don't begin so. So now make I think say we self we for join them. For join them. For make we re-echo this cry. Because we know they are listening. So now make we join them. The one them we go give that water. He say how long we go depend on white people them for we own existence. Whether they don't tell you say the NGO that support group they come now. Hey, Papa God. Not to even an internal NGO. I want to feel an international. Because with what he talks so now. How long we go depend on white people and for we own existence? We are surrounded by sea. The water na bed. You know they far from we? You say California and some other areas them. Na rain water na then depend pa. You say Bonaya who get rainfall every year. He makes some other points then. He says so many options than they. Yet 5 years on, we still there. We still they talk about the same thing. Say after in the talk the previous day, Ministry of Health and Sanitation, they're not even shake. They're not shake at all. Passway na the white savior. I ain't care what I go for them. Eh? So Paul Alala, Ministry of Health and Sanitation, then go say then they pan transition. He say I seen the talk so in all the urine na in bladder because the place not good and in no go goodie for go use them. He explain more about that girls we say not in a theater for use. He say then we get patients where we get an obstructed labor at a nearby hospital and then we need referral for bring and come day. But guess what? No material for theater. He say obstructed labor now one of the reason we woman them. Then they get ruptured na their uterus. And if no theater material or water, what do you think say go happen to the baby or to the mama? If pre-adventure hey, Papa God. The doctor, by some miracle, save the mama, the option go be slim. Sometimes, you go salvage the uterus. Sometimes, you go subtotal. Or, sometimes, some of the words the way they use, I know call them. So, imagine 28 or 15 years. Wow. Okay. And so the thing go. Better one. Cottage Hospital. Presidentbio, we don't visit. He be tell you all waiting, he be think at that time. Over 2 years on, waiting change. With this kind of explanation where you don't hear now. Why I don't give you? Waiting you feel say change. Or Presidentbio not get an agenda. Like I said earlier, Presidentbio, una depend yes, depend yai, depend mot. Please, a need for visit in the back. If not, we don't help her now. Now this time they go on. Make them see changes tomorrow morning. Make a come with us friend, make we what thing you get for it today. Yes, us friend, you get the platform, sir.
Yeah, thank you very much, Triple A, for giving me the platform. And thanks to all the listeners and viewers in here. And then let God continue for a blend platform, understand and listen. So that we didn't get for put before, then put them before, and then they carry on. But this issue here, so the guys say we don't discuss that really. But here it comes now about the water and the personal hygiene and the cleanliness. Was the care quality. Was now more of care quality based on care delivery. The one that when at the management, then a different issue. But here now, waiting the need for let the hospital go get that quality in terms of the good health care we go need. Some of them think they are not in the way where they're supposed for day. And waiting at the next thing on the side, we can always expect now a lot of infection in terms of the infection rate will increase and other sickness way related to them kind they go advance. Because the main issue of the water and then try to find out why first the water no dey go there from the area also we dey get am. When at the main side, why you know the reach here? Because we dey get am na the neighborhood. We dey get am there. I say why you know the reach here? So you go try for things. Obviously, now the pipeline gets a problem. All right, if the pipeline gets a problem, now the place of Fuda, now the place of Guma Valley, and the Ministry of Water and Water Resources. All right, so you go say that's the one main thing. Then you go kind of get into the particular issue way concern inside the one that way concern that like the health sector and the Ministry of Health back. So what's in your duty now? In your duty, the other side for provide those essentials will make up a good quality hospital. Where somebody go come, he talk say, then they put patient first. But here comes to the area back where they say, waiting them they put first, or waiting they put back, or waiting they left, or waiting they ignore, or waiting they say, well, we'll do it later, or we'll do it because of this reason, or long wait, this don't find, we'll get this wire. Those are the things they start to question, because now, here is the hospital, we need all this quality. Here is a professional healthcare, a medical professional, we did it with a doctor. They try to say these are the things we need. So those are the accessories that we need. Those are the essentials that we make up the component for the hospital for run. Apart from the good building, apart from even the good bed, those other things that we make the thing they go. Nine other hygiene, that care quality. We even in Europe they check them every day, that care quality more. Now they start the care quality on the place in cleanliness. Then how the people then where they deliver the one owner the care now, they come to care delivery, and how they go manage them, how they go manage that care, the care management. But this side of the nurses they know them foresight and they. But those are also areas you not the management side, when you not the minister on the top level. So that that thing there you get for looking so because you don't undergo that process, that you understand waiting the nurse they do. You know, see the nurse may the guy get for access the patient, they get for get that care delivery one for the get for managing care. You go one for put information at the na data system for record them. You go one for check the temperature we can inside. You go one for find the way for admit them. Or you go one for care medicine. So those you get the care package, you manage them, tell that person they in journey where you take from your host, you come back, you go back to my house. It will be an eventful one where you always know see what goodie I get a proper care delivery. So, but if they come back to the area of this water, particular force, we bring up the light. You go see what they say. They put things sometimes before or sometimes they go say, well, not trying here. Because when you look at the threshold program, or this MCC, where everybody talk about this Millennium Challenge Corporation, then we don't organize the Millennium Challenge Coordinating Unit. When are some like soiree, we read them, then we don't get the signing of this program from 2015. Delay. All right, they kick up with them and they are kind of side. Now there's this threshold now they give you now, which is separate from the Millennium, the one where they give you as an award or something. So this is just like when they say it's starter, they go get appetite, but then go do for them develop the electric and the water for Usai na the greater Freetown. So they say, okay, well, let we go experiment. Instead of them involve the health, they involve other things, they involve the tourism. They say, well, would they do them for let we improve the tourism? So you go question, say, well, it's very good because people in Aberdeen, then we don't get a problem because of the pipeline, and then we don't do the phase 2, one of the water booster, when I go pump the water, then we go up that pressure day from that place when they call not just how they call this they get the actual place they just now Aberdeen. I think now right up now they call this place just okay the golf club now there the thing will begin. And then from the golf club, now it come down just next to the they call it Kingdom, Family Kingdom. It's just a simple word. Family Kingdom was the route. When I 4.6 kilometers or something, 4.5 kilometers pipeline they put. Okay, then they plan now for 2 reasons. They say when they put them for let them increase tourism at the place. And then if the pilot scheme is fine, then they get money from there because that area they get meter. From this year will be deeper. So now from last year, then now they pay by meter. because of this new thing we don't go do there, which is working well. But again, you think say then before don't try expand this tier. Or then for don't see well, instead of they think say this tier it will bring up revenue. And when you bring revenue, how money they go see when then they replicate somewhere else. And it cost about $44.4 million just for that project, and 2.9 in billion leons. But the problem is they don't go put and say now when the money come up, then they go replicate another one. So these are all you go think say well, and that's not what Millennium said. This is just what the one then when the community they say, because they write the project, because we are going to write the project and show to the people them. So are the questions they let them try think of ways when they will increase the pipeline system and the booster, because it's to do with a booster, and they make the water know they pump in that area really well. When they get the booster and they pump the water, they go even right up, then they get the pipe system where they carry the water. So that now one issue we get for try identifying that area there. Because when it comes out to the issue of water, it's very essential in any hospital. You use the water for sterilize those things where the woman they call about speculum. You clean them, then a gynae area. You clean them after, and then you sterilize them. When you sterilize them for 1 hour. When at a temperature of 80, instead of the washing first, then the washing. So they sterilize, they wash them first for at 1 hour. When they undergo not to in one or now we they get a buckle for that department day. And they want then they then get special sizes, then get special nature, then get one the winner insulated one then. But now then some they use the metal one. But it depends what they even have those which are disposable, but those are for people that when they go at the field. But all outside they say these are the things we get for they for clean out in the water in it, when are blasting. Then for can't put and let go wash again. When I pre-wash, you wash it, they take 1 hour for clean and they back at a high temperature. From there back, you will go wrapper now inside a packet, you sterilize them, you keep them for if you want for reuse them. That packet they back is sterile until they open them because nothing one invasive one. Even though you're invasion, you invade go far, but the cells that we inside the invade, they are exposed cells when epithelial cells. Like when you open your eyes to, you put small salt like here inside it, they feel the salt, that way they put on top of your skin. Those are the type of skins where the thing they go church. So you have to keep it and then you wrap her now, go sterilize them for another 1 hour. You're looking at them now 2.5 hour journey where that's really sick. Any step now water, you put an autoclave in steaming. Water for day. The one that when they walk, they get for wash their hand. Then you come out to the theater back for scrub, but not so easy thing for scrub. When you scrub, water no they waste. But you use a lot of things, different steps. Those particular steps, when you take for wash your like where they show you, now they take but in a repeated form with a brush. Then you go do the procedure we get for the come back. All those now water you go need. The floor you get for clean them after every operation with chlorine at a certain amount. Now water you need. So that's how now you go see when the water is needed in the hospital, the water is needed in all aspects. You get for do all that procedure, you get small basin and even small procedure, you don't make medicine, you go do rounds, you get for can wash your hand. So then get for make sure then get what they call a reservoir. A good reservoir of water, the elevated reservoir, and outside like a tank there, when elevated one there. So when water they even want to run down, this they continue and it always they refill at an alternate time when they don't see the water now go there. So those are the things so they get for do, when they go able for try, so that place they go able for find and get for try repair instead of thinking of making the new one. When na something when a private enterprise, it will open opportunities for other things. But what about we your home base, we will try develop, and then from there now we will say they are going to replicate. Just like otin water guma by the same way, then go wait we come out. When they begin the pain about it, now we go take now, then go pull if it succeed, it come out fine and go use that last time, then go do other thing. But these are not the type of things we then get for look into in health. Health. Now, in the main thing where they hold in any country, and I need help for development in any country. If then they look at certain things and then they play around with them, they know if not game they play or they are doing them based on the availability. But when you look at it, and look at it, go say, well, why they don't they go put them outside there? If they don't count with the money, they say with the give now. America, we don't sign them from 2015, they draw, now it begin. Why we not go see, well, this hospital and any problem they are based on the person who been there, we will identify the things there. Because some of them, they come down to the nurse, then they come down to the matron, then they come down to the layman they for understand waiting exactly, then they need at the place they then go just stop, then we just look around, then we'll get feedback, then we will really go for see waiting the patient need, waiting at the style. Just like what that man they talk about people who the audit in terms of the way they go for do auditing or ACC investigate. That person we know some people when they go in the hospital, they see you they identify the problem, you they know they're not going to balance you because you've been part of it from the scratch. You they up. Those are the agents they get for finding at the hospital for see. These are the things they will go for do. In other words, they do every week. People and they do which they call a kind of a safety check at the hospital, where they do like a small auditing. So that small auditing, and then they go review them. You go see now that this box is full up. You get the amount of water now. You get the amount of speculums. You get the amount of gauze. You count to gauze again. Very important in operation. I go carry out an operation without a gauze. You can't do it without a gauze, despite the dressing. The dressing if is there. So and they will like doing they do operations and they will like gynec operation. I found the woman they talk so. Then they do delivery there, then they do one day we get complication of a gynec problem, then they do quite a lot of them. But it is up to them. They don't build the place, they don't develop them. But now for maintain all these structures, why they say the day inside, we will make the thing go get for go before. So a person, you know, go look at from the outside, see the function. You enter, you see the function, but waiting, you therefore do the service to the person who now ongoing, not to stop, now ongoing. Now for that hospital, not the lock. Now for that church, not the lock. Now for that police, not the lock. Because these are ongoing things. Them even if you lock down, and then they call essential workers. So these are essential the community. So you have to make them survive. Ongoing process. You see, that the hospitality, even when they don't make a roadmap, they are going to be the last to be open. Hospitality, the last thing they think of when they find this pandemic. Every country is hospitality, and they put behind. Then they put the education and the health before. So these are the things when people they look now with this COVID thing on can for bring to leaders them to look. This is what we have to sit and start thinking. It's like a trial for everything. So thank you very much for giving the platform. And I'm very positive there is going to be a change. But the only thing, at the time when this change is coming, people are still waiting. I'm knowing that a change is going on, but how is it going to be? Is it going to be structured in a way where we go for repair half and half, or can put 14 now just smooth going? Thank you very much for giving me the platform. Let God continue for bless you, sir. Thank you, sir.
Thank you very much. Oswen, thank you, sir.
Yeah, most welcome, sir.
Yes, sir. Make a count with Dr. Aisatuka Kejalo. Make we waiting you get for we. Yes, doctor, you get the platform.
Yes, hi. Good evening, everybody, and I hope everybody to do fine. Even though waiting with the right now, there's no could make anybody feel fine, about we country. And thank you to Us friend for all the don't outline, and and to you as well for reading this to we. We will not get the opportunity for Yeriam, for seeing on Twitter. I feel say first we want for tell Dr. Cole for in young sacrifice way it make for give time whenever it in a salon for try for help with the obstetric and the gynecological sector na the maternal health na the country. But in order for make somebody continue for help out or for continue for render service, whether you do it voluntarily, or whether not pay they pay you, you get forget the things we go really make you do your work. We go today, for ensure say you do no harm. One of the oaths them where any healthcare personnel they take now for do no harm. Yeah, do no harm not mean say you do it intentionally or you do it because something just happened. So this is saying not hurt the patient. Yeah. even Lord start by the hand washing to start with. Where we say the reason for hand washing are for let you prevent infection, prevent cross contamination from patient to patient. Because if you knowingly say you don't left a patient room, I just want to start with that. You know what's then you continue on to the next patient. What do you do? You take infection from one patient next to the other one. So it is very important and actually, ethical in a sense for like the physician, or the obstetrician at that point say no. Because this equipment won't I give me so when I the speculum, not clean. And for say then they use the speculum, wash them with soap and water and then reuse them, and the water then they use now plastic water. Now a disgrace. Disgrace to the healthcare system. Disgrace to that particular ministry day for letting them know they look into some of them things they have so who that can actually go around for do some form of I don't know, either whether not yearly or twice a year, every 2 years or 3 years, I'm not sure, but every hospital system supposed forget committee wait for they go around for ensure say things then they in place wait for let the hospital run appropriately for make sure see the patients then not lose their life because of some of the either negligence or because measures they're not in place, because things are not there where either for let people do their work, right? I say this because here in the United States, again, people can say we don't need to compare Sierra Leone with the US. No, I will compare Sierra Leone with the US when it comes to healthcare and how healthcare is supposed for it. We get what they call the Joint Commission. Every 3 years, then you go to every hospital. I don't mention this now before. They ensure say the hospital they run according to standards. If they not run according to standards, then they give them time for fix the problem. If they're not fix them, then they cite that hospital there. And if they're not fix them, if that problem they continue, then they eventually close the hospital. So let's see how serious healthcare is. And if you get bodies, them different organizations, then where they just for that. And I'm not sure how that they run our country. For find out, say, a speculum where they use for do a pelvic exam. If you don't decide for use the metal version of it, because then get the disposable one or but the metal one are the one where then they reuse, but in order for you reuse them, then for sterilize them. And everyone where the obstetrician or the gynecologist they use, therefore use a fresh sterilized one. And not to then serve for even WhatsApp. If we go to a special department where they ensure say they sterilize them according to standards. So for letting use that, the thing here is AAA, exactly not just because I'm a woman, I know about what we're talking, but I also do this type of exams in primary care. Because being a family practice, family nurse practitioner, you can work with, you can work in a family practice, you do gynecological exams and all this. I have not ever reused a speculum that is like as the doctor described. It not happen. In many cases, to tell you the truth, I don't even use the metal one. I use the plastic one, which is, you dispose of it. Yeah. And Usfreda already don't say, you're talking about somebody's, skin, you're talking about the, and epithelial cells, with that, now that could really tell you and help you for like determine if this person, they get any internal bleeding within the uterus. But how can you do that without the speculum? It'll help you for visualize within the uterus. And then we talk about water, not this. and they not even get a disposable form of it for say, okay, because we know say we no go get water for sterilize all that thing there. No get a disposable one where they come seal in a packet. Now you do open them, then you use them. But that's not the case. And when they talk about healthcare system now, we talk about always, constantly, because we feel sick. Now, anger for make somebody do well. And I always emphasize on this. And like just today, I was sitting in my office and I decided to just read the mission statement for Sarah Network Charity Foundation. If you go on our website, for those of you having took the time to really read what our mission statement is or what in our vision, I want to do that. I did that. And everything points out to healthcare. Healthcare. You know, an office away, you know, I don't put all those things together. I just thought about it because I'm in the health field. No. For let you do anything, even if you're not an economist, you're not a lawyer, you're not any profession where you have to be healthy. And then we're talking about women here that have to be able to reproduce, you know, another offspring. And for let them can't do the regular exam or then they complain of some symptoms, you know, vaginal bleeding. Most likely this person maybe now abnormal vaginal bleeding. We can be say no, you know, normal for everybody. Not to somebody where they're at the reproductive age, maybe not somebody where don't past menopause, and you think about what when these things happen, cancer. But with President Gode 2018, he said the place no pleasant, you know, pleased with him. But what did he do? What else did he do? And I'm a question. Did he try to put resources within the healthcare system for say, you know, hold on. Hello? Okay. Did he try to put resources within the healthcare system for ensure say, what thing we get when at the cottage, when at the connaught, when a government hospital, where be say where the poor people they are the one then we're not able for afford enough money for going to a private hospital. Did he feel like it was important for him to pour money into that rather than celebrating the fact say we don't open a ultra modern hospital or we depend bill them? That money when they spending, and then luckily he said they put it away the Canada and they bill them. But what about all the money that way anti-corruption get? You know, where they get, they say they get for build a diagnostic center. Why they not go use their money then they renovate this hospital and put it into standard? Make sure say the hospital is functional. Even if you build a new hospital, their hospital then they still go serve different communities them. AAA, the hospital where they work them built in 1955. But from the time when they build them, every time then they renovate sections. And then they don't only renovate section, then they add new buildings. Some of you know, you know, in the Bronx, you know, at Jacobi Medical Center, you go see multiple new structures where them put in. And even the old building, then they renovate where they want, you know, they want to expand something, they want to do something. Now make healthcare, they go before overseas. Because them feel say just because you get new hospital not mean say the one way you close them, you put them like say it not exist. Oh, it exists because now a teaching hospital then Dandy. How you go encourage people then for let them go into the science field with the type of things and what they hear about healthcare in our country? It make them very difficult. Even the young boys or young girls that wants to be doctors or nurses in that country, things like this makes it very difficult for them because we not even get the institutions them for care for the patient them, not to talk of even train the students them when them done medical school. or where then they go, during them clinicals them. How you expect for do you clinical practice where you can the place where you dey water no dey, the place where they surgical supplies, then or the way you mentioned the gauze. If somebody they bleed, that means you want like bleed to death, or in Lapana for loose for go stop the bleeding. When even therefore take the blood very well, because think of that lapa and the gauze, the texture not to the same. So we really feel say, we government need for really take a U-turn right here. They have to take a U-turn, because this is very important. You talk about people in life now, so you get make woman then make woman and they die, either during or after childbirth. Because if that clinician not really follow all the infection control measures them, because they not get the equipment, then they decide for reuse things them without being sterilized, people then go get infected, and then go get infected and die slowly without even knowing it was because of infection. You're talking about hepatitis here. You're talking about HIV. You're talking about other, UTIs, where they go on. Then they reuse them kind of thing without sterilizing it. I think it is scary. That type of healthcare system there is scary. If any clinician decide for practice, it practice with knowing fully something is wrong here, and then do the work. Because with that, you don't harm the patient. Where we say then you don't actually violate the oath where you take for say do no harm. Yeah. So we the hope say the new Ministry of Health and Sanitation, Dr. Augustine, hear this. It do something, because I think we want to start with our force. Then let him go now and tell the presidency, you appoint me for do me job. If you want to do me job, I think I for ensure see all the hospitals in this country forget the things and where they're supposed to forget, for let them do the work correctly. And the next thing again, the department or the committee where they're in charge of ensuring that hospitals then run effectively, with the hopes they then back come on board for ensure they then do proper, tour. Now all the hospitals there and try for outline waiting they go on. In as much as we want let the government do pour money into healthcare, but the one them back we need for do the surveys, do this, the data collection for report them. If then self not do their own, it go make them very difficult for let the president see this. But the other thing here is, again, I know I'm just take this because that 2018 visit for be an eye opener for we president. Unless me, I somewhat sometimes they say, in need for they go back and listen to in previous speech them, or listen to all the things and way if you don't say it do that first year we take presidency or office for say, I be don't talk this. Did I actually fulfill this promise? But if you not do that, that means you have to go back, because you're not gonna go forward with this type of things surfacing about the healthcare system na salon. And for a lot of people,
Doctor, before you go,
yes,
one side way the doctor talks, say where you talk, you get call from upstairs. I think that one day, because sometimes people go ask about, they know they talk, the one day they work there, fear for say they will get fired, and who's going to hire them? So, but this one, because of the kind way in the render your service, so now I'm making able for talk.
Right.
So this one, yes, we need the president, but even the one, the big one themselves at the hospital, are they not saying where if the younger one, the way they under complain, then go call and ask them out? Why?
AAA, it now the problem that now we can't get. You talk about freedom of speech in certain areas, then but we can't to life and death. People then talk that you want for, either shut them down with your power, knowing that you go either strip them off them badge or off them the pin code where you give them for let them work now a government institution where be they don't even pay them well. But me, to tell you the truth, that the doctors then get for understand say now then goes na the school. Not all person go school for them. Number one. Number two, now then take them boards them for let them become certified for practice medicine or practice nursing, or even become a midwives or things like that, right? We all see where the recent graduates of midwiferys, where them, where the I believe there's some fund where they help you in post at the website, where they all graduates, but then still say we don't get enough midwives now the country for match and cut down on the maternal health now the country. So if you they threaten somebody where they doing job, it become very difficult for them. And actually, that means you don't care about the human capital development where you talk about. For say, oh, if I talk, then then they go take upstairs. Which upstairs? AAA. Being a provider or being a physician or nurse, you get some form of autonomy for speak up for your patients, for advocate for your patients. And that's not one thing nurses do constantly. They see the nurse, they advocate more for inpatient more than the physician. I'm sure there's a lot of nurses listening and they will tell you that's the truth. Most of the time now the nurse and the advocates. So they see the difference here when you get a nurse who decide for become a physician. The way they practice, or you get a nurse where when a nurse practitioner where they practice, in either a midwife, then your way of practicing is quite different. I'm not condemning the physicians here. All I'm saying is if you say somebody to stop you for let you talk, trust me, that's not the job for you. Because then you really not try for uphold the oath of office or the oath of service where you do on the day where you graduate, because everybody gets sworn in for things for when you graduate from a medical profession or from a nursing profession. And when you come to the clinic setting, you should be able to advocate for your patient, knowing that what you do, it will cause harm to the patient. Especially when it will cause infection, because the patient don't know. The patient don't trust you, say you knowledgeable. Now you don't go to school. Now you know everything about in health problem. That trust where the patient don't instill in you. You self get for return down the back for ensure say, go do something to them, we go kill them slowly. A lot of mistakes that can happen during the maternal health profession, wait until the physician decide. Now make so then your malpractice insurance is very high. It's high compared to somebody where they do internal medicine or where they do just other types of medicine, because people then they sue for things like this. But because they know they sue now we country, now so the people then they die left and right. Nobody know they take action. Say you don't now because of your negligence or because of your mistake. Now make this person lost in life during childbirth or after childbirth. So then I think as done now one problem, to tell you the truth, that's not a whole problem of its own. But then we believe say we government get for try for put things them in place for make physicians them, midwives them, nurse practitioners them or nurses them na the country or public health officers, and let them do their job diligently without harming or causing harm to the patient. And for say what not in a hospital, which hospital go there where not forget water? How they was yan? So you talk about infection, how you cut down on infection. I'm so sorry to hear things like this happening in Sierra Leone. The only thing we can hope for that things then will get changed, and not to for wait because past that new hospital come, before we get things and change. Whether the people that wait there for day now, so you expect like lost lives them until that new hospital come. That's not the way to go. To tell you the truth, that's not the way to go. It's a disgrace for us. And with the hopes that we president go there like ASAP. and he's sending people and they like ASAP and let them do something about this. So now that's all I want to say. It's like, it will be ongoing. Thank you.
Thank you very much, Doctor.
Yeah.
Yeah. Yes, 22 Jones, you get a platform. What you get for it?
Yeah, Abraham, I think say the management problem. You understand? And I feel say the doctors then get for actually focus on the core competence wherein for provide services. There are certain departments where you get for left solely for administrators them. But what would you see, you understand, as alone is different, especially when it comes to the health system. I tell you, I'm the talk to me, Dr. Paddy, with me say, Tony, it's very difficult. Some of them go facing an alpha we or waiting a say this now an historic problem. He say even when Zainab and Goram did it, this not one problem. I think I think they need for able for streamline certain functions them we actually therefore be done by doctors, like waiting at the role. When it comes to management of the area, then they will have to deal with facilities, especially facilities where you provide at the hospital. Left in the hands of people that we even know, no, not to even medical people, medical and practitioner or people that we know if probably get knowledge of medical stuff. You understand? Because I tell you something, when you talk about the other facilities, so just the water no more, even the light system, you find out say you as the head or you as the waiting a call, you get forget a tracker, you get forget a system wherein you able for monitor everything where they happen. Then you can have money, you understand it, you get your whiteboard, you understand it, where you find out say all the core areas then way meaningful na your hospital or way meaningful because we yes we get for blame government, you understand it, but government no go can begin micromanage you now your region or your hospital where you manage. You understand? Then make them give you the free hand, you get budget, you get everything where you deal with. You understand what I mean? You not just get for the can school you tell you say do this, do that. You understand? It's rather unfortunate when some raise their voice, then they get called from above. But at the time for facts, especially salon, some of we don't work there, we know exactly how the system they run. You understand, eh? When you get your hospital where they on, you foster alternative. You got plan B. If you know say probably Guma, then water, they get them problems there where they get probably a problem up with the supply. You understand? You get for foster alternative, say, let us have a bowls. Who go they treat them water, we get them. Some hospitals then they do them. You understand what I mean? You go surprise for no say even Amuti no sama this. You understand it? Now borehole we get because all the pipes that where they lead. Imagine from mile 13 to Hamilton in a short distance. People then go for dig boreholes because people then they cut people then pipes then on it. So in the situation like this law says then situation and they happen, you get an alternative. Make arrangements with Guma Valley for them they can supply. You understand, eh? Especially for the hospitals them. Not to even say only the hospitals them, but most essential areas where you find out say they need water, they need other facilities where really, especially with lights, get plan B put in place. But the thing is now we country, this all politics about oh that man they try for sabotage we now we no more not now we send not na APC man or send na NGC man, they begin label you waiting a call. But you as the DMO or you as the hospital head, those things for be least of you worries. You focus for be usai, say now treatment where people if not treatment people in the go to hospital don't able forget, we can understand. But what's not for be something where we get for they begin to cry over and this and that. It really sad. It really, really, really sad. Not at this 21st century, we get for they get then kind issue then they everybody want for be administrators, every doctor want for be. So then they forget about the certain areas. Everybody they concentrate on funds. Who say money day, who say money day, who say money day. You understand? Eh? This is not the challenge we face now we country because there is no standardized payments now we country. You will see people there. You will see even junior doctors, some junior doctors, they make money past certain senior doctors because you get political appointments where they put an aside where they get money. That should not be the case. There should be that kind of a situation wherein people merit whatever they get. But now all these political appointments, all these kind tribal connections, all this kind of nepotism, sectionalism, all this zim come into play. Then they make you find out say the productivity questionable. We're not able to forget much quality in we delivering them of services them. Because when somebody fail for deliver in service or fail for giving your play your part, it you know usai it connect to the power that's been. So you not care. So they make you find out so we get all these challenges now with society, not even the health sector. All the other departments we will see every day. It's the same problem cut across. Because people don't care. Would I just be saying because most of these positions they are politically appointed positions. So normally, you know, that man in the pie in Sister Law or that man in the pie in Border Law in this. So you find out say people don't even they don't even concentrate on providing the service where they appoint them for. But if you go hospital where then thing and then this not for be them for even come on air. Now phone call, hey Guma, we not get water not the come. We need water. Simple phone call. And the possible way they call at the other end, for CM as a priority, say, PCMH not get water, all the water they want to go supply. Or when I for meet the board and say, what thing we go do for improve this water supply? Let una know the get situation. Because you can't run a hospital without water. It's not possible, say, you go run hospital without water. Now the same thing, you know, go run hospital without light. Look at the lights, this net in a salon. Hot and light, like a Christmas bulb. So if I now say, no sign of the way they pull way better. Imagine they run hospital, then kind lights, then they go on and off. Within 1 hour, the lights go 8-10. Tell them if now operation and they do. Then the hospital not get generator. Not get good generator, not to forget generator no more. Good generator where they send full power. So all the things then the way you take them in context, then they make we country they suffer. Every day you see death. Every day you see young people they die. Every day you see people they go born picking they die or the mama die. Because of all these small challenges. This should not be the concern of the doctors or whatever. They should be the administrator when not necessarily be say these are doctors or this. People the way they manage the affairs, the realm of the hospitals there. Even when on their own field, when they're in charge of facilities and this, where they handle those situations. But nobody cares because most of the position of the country are politically based waiting a call. They don't know what your competency, they don't know what you sabi, they don't know if you're able to fit the position, they don't know how your level of responsibility or your level of leadership they then just say once this man at the middle of the party and they support the party, we get forget this position. So people do not care. Everybody focus on the money. People do not focus on their jobs. On the thing the way they pay them for. This is not the problem. We cut across all area, from Wataki, from airport, from all sides. Not the same problem. That's not my own take. It should not be concerned. The president don't want to too much burden and too much. He appoints people there. You get ministers, you get DMOs, you get authorities there. You get chain of command, you get the organogram, they get arranged. There's that structure before you even meet the president properly. Some of these things not to tell we for the call president. The people that we did, they would not delegate responsibility to, that therefore they do them here. You know?
Before you go, you say some of them are not trained for call president. Now here we see where the ASA, the Academic Staff Association, where they are where they tell us that the president will fix this no more. It got fixed. In Sierra Leone, yes, you are right, not to ultimately call the president.
You know why
but
the president
in certain situations like this one, I think say the president attention and need for come inside it so that things go change.
Abraham, with the ASAP, the university, then at the university is chancellor, then at the head of the university in Salon. Then make those days, now the president had a confer degree. So it's part of the system. So you know exactly because when he can December, when they confer degree, now the president they go. So it's part of the problem. It's part of the whole thing. But nurses, you understand what I mean? In nurses, you can get the new structure. Just like our University of Salon get the new structure. What you make me they say not to alter get for labor. Abraham, let me tell you why I make some of these ministers the way they appoint, they succeed. The doctors the way they brag say now their ministry. You understand what I mean? Me this me man they tell you when me they talk the other day. It's just some of the doctors in the brag. This is not ministry. Not to not minister say for carry they go. If you know I go back to we and this and that. You understand what I mean? Them focus, they all want to be administrator. They all want to up there for manage funds. They all want to there for eat money. Nobody no one can make if I say we not get specialized doctors they no more. Look like Dr. Russell, the doctor. You see how much money they make. You understand what I mean? You got all these administrators, this specialized doctor where they fix for deliver. They all in office.
Well,
So
even
all the
if they're in
problem
an
now with
office, that's how they should have things running. Administratively, they're able for coordinating kind of thing, but that's still not happening.
That never can tell you now problem with management. Abraham, when we meet the manage what we tell what we all the different managers in the region, there is competition. Every year they have most improved region, this and that, this, that. You understand? Motivation, who say you do with challenge, with competition all day? Not just political appointment. Now, so you get for see things that happen. Because people then feel say that they scot free with certain things, then way they no say, but I mean that man they na big man at the party, or that man they na card carrier, or this or that. What make me the say not to all together for labor get involve the president, because then a medical people there, then take oath, then take this, just like our Dr. Asatuni they say. Now then field. If the field successful, now then get the praise. Now then they do not take oath, do not go to college, do not spend 7 years, do not this, do not come. But majority of them now focus on funds. All these AFA funds where they come from UNDP, this, that, UNICEF, and this, that, all now are managing funds in it. So if I now say you left the junior doctors there, now the hospital, and tell me true, that man just come out college, you not get too much expertise, knowledge, you not get that leadership waiting and call. Then make first like that's an way Dr. Russell them in the practice under Willoughby. I remember that tell the Dr. Willoughby na my doctor. Those guys were very so they get doctors the way school, they just like one lawyer go come out law school, you get doctor way to go, you get lawyers the way to go in at the chamber. Let them learn the job, let them learn the ethics, let them learn the profession. They don't just go learn the money for evening money, but they learn the ethics. How you go for put professionalism before money. Now, so them in the land. Now it's a different thing. It's a different thing, brother. Go when you will go salon, just go to the hospital. Let's see. Go not to hospital where you the troubles. Not get better wheelchair. Wheelchair when I wheelchair, come on wheelchair. As if one guy touch a patient in Wakadibu. So many challenges and lapses. We don't say we don't get a doctor now way in field. Officers themselves in the count a leader, that kind of leadership in the count a wealth of experience, you're able to replicate some of those things. But so many challenges, bruh.
Thank you very much, Tony.
You're welcome, bro.
Yeah. Yes, caller, you're live on air. Your name and where you call from, please.
Yeah, this is not Mike. I call from Philadelphia.
Yes, Mike. You get 3 minutes, sir.
Yeah, I just want to ask you a question, right, Triple A? The people that already put in charge, the leader then, like the past president government, the present government, that's alone them born or a foreigner then?
Mike, we're all losing as alone them born, sir.
Because the way they treat the country, like send a foreigner then just come for can take and go. You know, like nobody not care for fix the country. Like, you know, things like this before they happen, you know. Hospital like that, they not for they go without the type TR, you know. Somebody need to get fired for the TR, you know. This is unacceptable. That TR not for the happiness alone. But God, man, it's just frustrating, man. You know, when the day when Sierra Leone are ready for change the country, that the day we go change. But we're not ready yet. We just patronize them politicians they are, you know. When you in one party, if that party they do bad, nobody know they talk. When APC come back, when APC people they do bad, nobody know they talk. Now the problem is with Salone. You know, the people that wait for talking, they know they talk. You know, we accept what the politicians they do to we. Now we have problem, Danny. We accept, you know, we accept everything. Everything what they do to we, now we they accept her. You know, right now what they do so, now we say they accept her. Now we problem, Dandy. We accept everything. We they suffer, now we they accept say we suffer. Because now we want to let them suffer we. You know, it's very frustrating, man. It's very frustrating for a country like Salone. We're small, so the population small. For people that for they enjoy with the minerals and everything we get. For people that still they suffer. You know, Man, I get one big box and big box of gloves will be left from the donation. If you have a way, yeah, like get to the hospital, let them use them, because this is just frustrating. It's
Okay, I
very
will contact
frustrating.
you tomorrow. Let me contact this doctor where they do this thing. Then
Yeah.
I will contact you tomorrow. Yeah.
All right, man.
Okay, man. Yeah.
Yeah.
Yes, caller, you dey live on here. Your name and side the call from, please.
Hello, Triple A. This is Dave from Virginia. How are you,
Yes, Dave.
sir?
You get 3 minutes, sir.
Yes, good day to everyone. I'm glad that we're able to highlight some of them here where they go on at the country. A very, very pathetic for continue for see this kind of thing at the main city at the country. I mean, we not even count upline here too. This na inside free tongue. Now they will talk about so. What another the day now in hospital. Oh my goodness. And that doctor, what they do in own kindness, but at the same time, it look like they compromise the health of people them by using, equipment and stuff them way they're not sterilized, just
No,
like
you know use them more. You know use them.
Oh,
You say
okay.
you know use them.
Okay. Okay. It is wonderful that compromise that side. Well, kudos to them. Well, another kind of example we need for sure some of the people them. A kind of very strange way. I mean, a month or so back, we'll be discuss about doctors or people that will go back to salon for go practice. I think they say when you go to a salon, they not go recognize you qualifications from abroad until you go back and return to waiting below some level where they below.
Yes, you go serve a house like how something.
So
like say you go
how
qualify back fresh.
Yeah, how do they make sense? Triple A. You don't get people that we don't come advance their education. We they get doctors that we in a salon, then they fly come out for camp study. Now you don't get doctors like let's say in the likes of Dr. Asatu, and he decides to make him move go back to salon. Really, who sense he make? We be say the current system, the basic hygiene where they for practice in our hospital, like they even happen. I see where where Pademba Road prison been break out. That breakout will be happen. Then we get fire force where come. The fire force been get water bouncer where they BNM. So it's like then get bouncer them where they able for distribute water. Why somebody would think outside the box and say, waiting, if fire not they happen right now, then water bouncer then they will they use for fire the fire truck them. Why we not go use that one day for distribute water to the hospitals? Or better still, the government not go able to assign one water bowser or bring water come to the hospitals. Let just be in work no more. Especially where they all know say water not the run go to the hospitals. It's very sad. Again, grandma and I they talk about all how them they do boreholes them, now the hospital them plaster them, cement them in a way that then they're able to keep water 24/7 where they run. Like Triple A. This is sad or it's sad to the country. It's very, 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 very sad. I mean, I join the rest of the callers them with this frustration where they go on. But yeah, I made them try that method they back and see. Made them assign one water bowser. We go to go now Guma. Come they come, he go around all the hospital no more, whether in a private or government hospital. He fill up the reserve tank them, he move to the next one. Made them try that. Steve, that will help the country small. But this is very, very, very shameful. It's shameful and it's shameful. May God help the country, pa.
Thank you very much, Dave.
Yes, sir.
Yeah. Yes, caller, you dey live on here. Your name and side the call from, please.
This now Cecil Cole and the call from Dallas, Texas.
Yes, Cecil, you get 3 minutes waiting on your contribution.
Yes, sir. Thank you very much, my brother. Let God bless you and let God bless Share Network. I want to tell all the previous speakers and plenty thank you. All their contributions are very, very important. It's very, very heartrending for see waiting to happen at the hospital and a salon, especially in the corner. At least say people will give power for take care of people in a salon, especially the vulnerable, the one that we able to make them, the kind way than they make them. Then for do way better job for take care of people in a salon. There's some of them people that will put in a power, they don't live overseas. They don't see how people and they do good jobs in hospitals, them, how managers do good jobs in hospitals, them. For they will take, then they go back in salon and go develop the country and do good things in the country. They know they do. I mean, it's heartrending. It's heartrending. Yeah, they feel them. I really, they feel them. They're really, really sorry. I don't want to use the word wickedness, but I feel that it's not pure, total wickedness. They ask for say, but don't call things by their name. That total wickedness for lay, at least you see come people and they suffer. But what's up? The country is, we are surrounded, water all over the place. We are surrounded by water. Only you say, okay, some of that will not use them, but there's a way where we can at least make the water and they usable by the hospitals then. But for the hospital, they don't get water. I don't want to say it's a shame now, wickedness, but what's that we people and they, where at least they run this country and they sit and say they happen. They get conscience. This is hard. But nevertheless, me, I take this thing back to parliament. If only we parliament can wise up a little bit, step up a little bit, some of them not happen. Because the executive branch can get too much power. Probably the constitution will take care of that down the road someday. But as it is right now, we parliament need for step up. Some of them say what happen, so we have to put the blame directly for parliament. Let God bless Salon and let God bless the people all. And let God bless Sarah Network. Thank you, sir.
Thank you very much, Mr. Cole. Thank you. Yes, caller, I did live on air. Your name and who the call from, please?
Oh, Triple N, me?
Yes, sir. 3 minutes, sir.
Oh, okay. Thank you very much, me. And this is Omar, the call from Los Angeles. Listen, I absolutely agree with Mike na Philadelphia in question. Mr. Seth, Kamarimba, the campaign. Ikana, California, I asked him. I said, Sierra Leonean. He said, why they ask him that question? I said, because Salona ever get a Sierra Leonean. We rule the country. Now we enemy them that we elect. I disagree with Tony. I put all the blame at the government in hand. We get hospital in America now, we don't call county hospitals. If anything happens, the governor don't know. If anything that will go wrong, the governor don't know. He go know because now taxpayer just like the one at Salon. Okay? If the president on Onaime could get minister, we get minister. What in the man they do? Now responsibility that. If you get doctors then, we just you don't know at the hierarchy for the take donation where they can responsibility for check that and clean that up. Now that they hire them for. When that guy they don't ever go to any hospital, we're not going to go hospital then. We're not government hospital in Freetown. Cottage, Connaught, maybe 34. What in the guy they do? When Alpha Woody don't ever go to cottage, we don't get Kumbrada who don't die in a cottage because they don't get oxygen. We get somebody again, one lady, we don't go for go interview, now back talk the man give them. So let us not say we say government and the people that know exactly what they go on. When you corner them, then give back talk. Now Alpha Woody na in partner in job that. Because many they talk about this new guy, not even 2 months it. Now Alpha Woody in job that. That guy then a bomb, just like Al in boss na a bomb. So now they made a blame. And cottage did close to me heart, because now they may grow up. I grew up na Mamioko Street for Road, Bombay Street. I know well about cottage. Then people here, sometimes again make me wonder, say, maybe I ask myself them question then this year. God really did a salon. Because you see most of the people that they call it Alaji Wuri, Alaji this, Pastor this, Brother this, Reverend this. Now then they sacrifice human soul. Now then they sacrifice human soul. You go now free tongue, any corner way turn, church day, mosque day. But now then they cause the hell. We not care about each other. Behind this almighty Leone and dollar. They blame the government. Now the same ministry, this woman that you say, now the two ministry that we do better. Not to say, tell me, 2 weeks ago, he said Ministry of Health. Well, now the ministry this. How you not go blame Madabio? Now the ministry this. When talk say, Now the two ministers and then the in and the one na education. Now they do well for all the ministers. Can you believe? Can you believe rubbish? The brother like God help we nine that, sir.
Thank you very much, Umar. Yes, caller, you live on air. Your name and inside the call from, please.
This is Ezekiel, the call from Oregon.
Yes, Ezekiel, you get 3 minutes, sir.
Thank you so much, Triple A. Sometimes we don't even know what side for begin, you know. It's so hard. It's so difficult. It's so tough. You know, sometimes where they think about how we they do things in Sierra Leone. So I don't know why the human mind is so bad off, you know. Whenever we they do things and feel that human feeling inside we say, if then do this to me brother, to me sister, to me mama, I not go take her. If we they get that feeling, why you they stand by and watch that they happen to other people and mama and sister and picking, you know? You know, every time we brother they say will not get through Sierra Leonean, and they get the same burning feeling, you know, they pain me because if you get that feeling, that love for human beings in general, you know, they come on thing they wait for, you know, every time we see them, it will make you feel really bad and hurt. They come on thing there. So for instance, if you see, you know, somebody else, they try for, you know, trap somebody, you know, if you get that human feeling, you know, they try for think, oh, not to me, brother. Then you walk away. No, you get the human feeling, you run and say, my friend, stop. You know? So it's the same thing way they happen. If somebody been in a theater and then he died there, and then you take your own picking and woman and all family member, you take them at the most prestigious hospital, or you take them out of the country using the country resources. And you they go and they don't feel good and sleep. Hey, that humanity is not there at all. It's not there at all. But I'm not surprised because that same spirit when people have been they use. I remember Rebel Camp that we played, those who we all they play together at the same school. You know, few weeks later we then capture them. And now they come around and call you stupid civilian. The very brother we will now all been there at the same village. Why would they do this to we Sierra Leone? You know, the other time I've been say the same thing about Frobe College. If in the 1800s, they call it we university, the Athens of Africa. That same hospital, the time we them build them, even get water been they run there. So why would they even advocate the idea of running a bouncer? If pipe been there 50 years ago, 25 years ago, why, with all the civil engineers who they graduate, why all of a sudden we can't fix that pipe? Leadership, poor leadership. And this now the very people where they don't give you one pega pack, you dinner street, they jumping up and down, up and down. Where that you sister they sick, you mama they sick. Now that poor place then they care and go. Then take them people and fly somewhere else. It shouldn't dawn on us. For say the president, while Ebola, Corona, they wait itself, they say go Lebanon. Which one was it? Which one wasn't? We don't know. But what we know publicly, they say go there for medical attention. You know? And these are the very people where they make you want to take cutlass for go chop your neighbor for them. Wise up, Sierra Leoneans. Wise up. And elect somebody we love your country. Thank you so much, Triple A.
Thank you very much, Ezekiel.
Yes, sir.
Yeah. Let's call ID live on air. Your name and inside the call from, please. Yes, you did live on air.
Okay, people, thank you very much. This is Elijah, call from Maryland.
You get 3 minutes, sir.
Thank you very much. First of all, you know, you don't tell me the party here. You understand? Small, so I just get example no more. What 10? They can 10 people go there. There's not one person they survive. Medical care not been there. And then they will pursue up till now. If me, now the president, waiting for us at the do, hold on short to Paris what so. The first will just come on a corner. You, the other next to them, they all are together, they all I go look at the up post a certain example. Because when I just come on this show, would have just come on the show where the other country say what I know they kind of the place. You know, therefore only people in looking up. We need to begin set an example. How long will people die? Cottage. They get people and go to Beluban and cottage. 10 people and go to cottage. So that 2 people survive and born picking. All the rest they die. How long will they put until they yet no action, nobody not take any action? Why make the people in the wicked we innocent people? Man, I'm telling you that God don't put in and country and because of the being they also for don't die. Because they get them belly accident, they have sick. Nobody go to court, but they better doctor there. You know, which is art for you make an hospital when in the heart of every country. If you don't get well body, I'm telling you, you are nothing. We don't see rich people there who they able to work. The people that go push there. We don't see rich people there who don't get money. Now other people in the country who they go wash them, who they go take care of them. So getting money is not in the team. Oh no, that's it. Thank you very much. Yeah. Not to forget the money that the team. That the well body, people in the pray for well body, the owner Sudom, when they see every day, people in the die at that place, they were not able to take any action. Now water don't do at the place. Come on, man. You know, I don't know I get AAA. Thank you, man. I just fed up.
Thank you very much, Alaji.
You're welcome, sir.
Yeah. Yes, Daniel, you get 3 minutes, sir.
Yes, AAA and family who listen to this program. I want to thank you for what you do for listening to Channel Network Radio. Bottom line is, you know, AAA, I want to tell Dr. Asatuka Kebayo, Jalo, thank you, and Uswen, because Dr. Asatu just come on salon. The thing is, for the first time, I disagree with my brother, 22 Jones. I mean, presidentbio in 2018, as you mentioned, he paid an announced visit to this very hospital. And he disagreed with the things that we see. Simple. He disagreed with the things that we see at the hospital. So therefore, a president who was insulted, once that the health care area, if they do a follow-up, this is 2018, this is 2021. Hospital, when are they people and born? Some of who born now, Ghanaian and Osinum. Who born the two go up the way each we was now, who's having to go get water, bring for let us Osinum, no one out of water. We Ghanaian, Mamidu. Would they go get water? We uncle and they ensure say light the we thought water for let them the command and the woman they will get let for short, light not for short. This man now President Manabio been done did it before. Doing MPRC, they been done did it tell them pull in continue hand over to Jankabana, I don't come back. Making promises, making not another thing. You get for emphasize, you get for make sure say things have been done. Brother Tony, I don't agree with you, sir. I know they wouldn't call you, but I don't agree. Now, presidentbio in problem with the parliament. If you put ministers, as you point out, most of the appointments you say are political. Then who makes the political appointments? Not the government. So if you put somebody in a square peg around those, the president is still responsible. All the other countries, then they go, look, Ghana, people and they go Ghana. Presidentbio don't live in Ghana. He don't did it for a while. You see the progress who Ghana don't make. Now, world being a problem. Ghana not being a, but they don't progress. He don't visit recently. Don't visit a country like African country, the Senegal. Presidentbio don't go there. They don't go to Rwanda. Rwanda will be a genocide. Look how far Rwanda don't do. Now, President Kagame, I work with Rwandese, the Edmond here. So they all don't go back. Who don't turn doctor and country, now the president, they work out with the young people and I depend on. Now young people in the show waiting for them. Rwanda are the fastest country, growing country, past other country there. So this what me they say, AAA, presidentbio and this is new minister, because all left Alpha, they don't come out. This now people in life. If that hospital, not even cottage alone, all the hospital there, what's it go cost the government with all the money they don't get from anti-corruption? What it go cost the government for ensure AAA that all the hospital and all the hospital and government hospital forget constant flow of water bowser there for Didi with standby generator. And not cost the hospital nothing. Forget medical supplies. Because just like Dr. Olajuwon, now people with them, people themselves don't be doctor. I remember who they go up, they didn't even do who they go post small na free talk. So then people they follow then standard. For go begin work with unsanitized equipment. No, Just as Dr. Satukakeba say, if the minister find heavily sustained doctor, but you go support in a salon again, what you go come up in that? It's a pity where this happen. And President Bio, the last day, as them point out, as this other man point out, he praised the health sector, the health ministry and education ministry. So, therefore, me, they blame the president 100%. President Bio for wake up from the slumber and visit all them places. They let make sure say instead of going the other president, this late man Ghana, John Lul, not like them because it make him because he go on the spot. Let President Bio grab, let go. They all them idea, them program here. Let President Bio do. Let wake up. Let go visit them places. Let go go no more Guinea or other side. Let go visit and see for instance and take action. Let God bless we all.
All right, thank you very much, Daniel.
Thank you, sir.
Yeah. Yes, caller ID live on here. Your name and side call from, please.
Yeah, this is not Patrick.
Yes, Patrick, you get 3 minutes, sir.
Me on a question number. Now do we or na swear we are one no? Because the way the leader they act like now do they. Why at this age up to now, people they cry for common water. Even if they know partner they run, they know able to dig water well. When not even reach $1,000, almost $1,000. Sometimes you for the ask yourself now do we na that country there as Uma says if that's allowed they born. Now they born. But now the question is now do they do them? Because when you look down and how they come out, they get overseas lifestyle, they don't live the overseas dream, they don't work some who don't know the one they will not get work self now, they all don't get experience health benefit in their country. Yeah? Some of them go under health insurance through the government, now then diaspora, they even now London, South America, or Europe, they don't enjoy them benefit they day. Why they not going to implement anything? So the question is why I ask to them. Now do they do them? Let we know. If I do, let go find that person or pray that God deliver them. Because how long will they pan this stay water like these people that die? Now do they do them? Because now only thing no more I make would they as we said the last time, some of them think they are. Let them be careful. Because if you not for them they picking them. If they make people that they cry every day, one good more man that they talk for you every day. As the crew man say, you not get shit. I don't think they get feelings. I don't think so. And I don't think they get feeling because if they get feeling or they get conscious, what they will call conscious, or the pillow that they talk to them, they know they do what they do so. Because if they get anything in there, they know they do what they do so. So no, I don't know. We don't really pray for that country. I'm not saying we don't pray too much, but we're not gonna give up. God will revenge for we one day. Because it's too much now. It's too much. We don't cry, we don't beg, we don't this. I think it looks like we left for the I remember Mr. Fatoma Meme say the only thing where they're afraid, we they blast for them on social media. And so we left for the do. Because the true will not go through them. But we don't begin the blast for them on social media, they will come to the senses. Thank you.
Thank you very much, Patrick. Let's call ID live on air. Your name and side call from, please.
Yes, this is Nancy. Good evening.
Yes, Nancy, you get 3 minutes, man.
Yes, thank you. Yeah, I don't know the leaders that will get within them problems. But one thing they fail to realize is even then people the way they taught pepper, cola, Maggie, and kerchief where they pass whole day, then they pay taxes. Because that keeper where they go ask them, say, if you pay 500, 1,000 every blessed day, where then they come out under that sun, under rain, then they pay their own fair share. And then money then they expect, say, therefore put the country so in a way that they self go benefit. That means good health care, good road, good drinking water. So if you then will lead us there and they take their money there, then take and eat them for themselves, make enrich themselves, then for no say every night, where then people then they go home and cry for something where then don't pay for, where then they give them. You go follow them and you go follow them picking them. Because this is just sad. And it's way they know say things really bad. Things really don't worse. Now when you see when our leaders them begin go, they don't even get mind for treat themselves. Now they in hospital, now they in country. Then get for fly out. Pay thousands of dollars for go see doctors. See them country they are just for see doctor for see you. You know, most they spend thousands of dollars. Then they pay taxes now, yeah, not too small taxes. Then prefer and take that money they can, yeah. That tells you things really bad. That tells you things really bad in the country, because if you don't get mine, for go na their hospital side and bond in their own country, that means nothing is working. The hospital system is bad. And I make up the say trade. The only way them people there, when we go able to forget them, for let them go do what they're supposed to do and force them. If they not go allow them, for let them come outside for seek medical attention, even with them family. Once you don't be part of the government, you're not leader now, whether you're not minister, you're not president, or you're not president's wife, now, it no matter. As long as you be within that cabinet, they not for allow you make you can seek medical attention outside, abroad. When you sick, then for treat you now your country, because now that make you be the leader for fix suicide problem there. If they do that will force them for let them fix their system, because there's no way any of them person sick, then go lay an account. They're not going to do that. Trust me, they can't. They're not going to cry them, picking them, or then wave them na cottage, because they know the condition na cottage is deplorable. They know say the equipment, they know they. They know say even the environment, go na corner to watch na window, let you see the kind of way they under they see. I don't understand. Now, what I know even in a cottage, sometimes lights go, people die. You know, can you imagine that? And they're still not able to do something about that. That's not an emergency for them. That's not emergency. Now, I make all this sick away they happen, this typhoid, because the water not clean. Feces they pan the water, human poop. They depend the water, now people they drink because they don't get choice. And it's not like people they don't want for stand up in a salon. They do. They want for fight back. But the president and all the cabinet, all the one the way they in power, they get absolute power. So when you say something, then they beat you, then go put you in a tight place, there's nothing you can do. And if you get a job, then go take the job now you earn, it left by you. And if you get a family for feed, there goes your family, they go suffer. And we all know now salon, some family then they sometimes are one or two people there. Now then they take care of a lot of people, school fees, food, and everything. So if you that one great person the way they work, and you go see say who side they work corruption they you want for AC head up and just speak out. Then they take you bread now you mouth and then take the bread from your family, because now you're not the breadwinner. So now you make them able forget to the people them. People they want for do something but they can't. So it's like then they between the devil and the deep blue sea. They're not get side for go. You want for go and out, you go drown. You go and out the devil they. What you for do now? Anyway, now that's our guess for today. Let God help we.
Thank you very much, Nancy.
Thanks for having me.
Yeah. Yes, caller 11 here. Your name and who call from, please.
Tripoli, I mean, Jalo.
Yes, Jalo.
I
What
come
you
from
get for
Germany.
3 minutes?
Tripoli, we don't lost we best government at our country. You don't know government, MPRC time. We'll be getting Saj Musa, then Captain Strasser, and Tenende. I remember we go on panel, we also somebody leave. You know, that part they always get to see Saj Musa and the man Chris man, and if you see no go work, they sack you. I say we work at that Susans for all the embassy things Susans for no well. We will get light, we will get water 24/7. Everything will the function of the country. Because we no go work, it basta you. It sack you. You understand? So presidentbio don't go na cottage. He say no graduate see. He's Mr. ATU in a minister, former minister of education. What is about But I don't understand why made it the pointies and pointies and pointies at the same position. You understand? You don't go take $6 million, you don't go give UNICEF. Why is the people they die? I don't know shop where UNICEF go with there, no one can again with the 6 million or with the property there. Do it MPRC time. Let them tell no Chris do them here, so we Sajimosa be there alive. I be no say President Bio back be there, you know, the same squad, everything be they go smooth. But President Bio start the same thing. I believe say Chief Minister, I ain't gonna go quiet President Bio. You understand? Chief Minister, I ain't gonna go quiet President Bio for audit nobody again. You understand? Eh? So me want the President Bio come up in the field because now in they get the bad name. Me I like President to I like President Bio seriously. So me God. I want to come on a door, like go and see waiting they happen at the country. People they grumble, people they cry, people they die in the country. And that woman they wait and say, then he go deliver. The woman he die after he don't deliver, it's win then. He died last week. And even the ministry of waiting and call. I don't understand what they do. This is what our business are. Come on, team. If only what I go up POs, that team way easy. The logo where they sell, where they call a logo, where they program for the pump water go POs. It costs €70. It's not so expensive. You buy the breaker, you buy the thing the way they use. And make they talk this from the beginning. Say the government needs to put money on hand workers. Then we get for bill we youth them for let them sabi do something. You understand? But them guys, I don't understand. Look, Chief Minister. In one green in office, look how much billion leos we eat. And we at least the last time we didn't say just communication no more. How much billion leos they use? Why is now Germany also the one who build here, for example, you get the connection we then do inside the telephone wiring. If not of a call outside, inside the building, now number you dial, you don't get your next colleague. You don't get your next call. But salon you all man get your telephone, they get. I don't understand. Maybe wait till they go another country. This government need to put money for the youth for the school there, build institutions then who said people they go learn skill work and for time for repair the thing there. So we from where Kashoma repair that hospital we in die so take today no church and safe. Now the same we go work around nobody in that place stay. President B, if you not come out, the country they talk about you government. You know go find no seriously. You get for come out in the street and we see how the people they feel. Like Paul Kagame, I don't transform in country they like today way all man they glad for good. Even me I want go holiday na Rwanda. Seriously. Right. So when I get for work hard before when I begin, when I left this thief first, when I work first, later I go thief. When I work first, when I just take no money, when I go keep on. When I work first for we, when I don't work, on that time when the revenue the case, when I go buy Alpha Jets now for myself when I begin to fly. When I work for we first, we get light and water and medical facility. Papa God, una they skill we na all the also now we are born we would suffer na the country. We don't get age now. Now 40 we don't get so. Still with the grumble for the same thing we will born meet the sufferness. Still with the grumble back for we picking away for can born. Hey Papa God, una no get feeling. Now for Solomon for dress a wear big watch, wear coats, and nobody in sabi. Nothing on sabi again.
All right, thank you.
They got a country.
Okay, thank you very much.
Okay, keep it.
There's not much to say here. The president, I don't get a message. Just in case you know one come out, for can check. And the message done this. Because 2018, Nadande, you've been talk. I remind you. Say you've been dissatisfied. You'll be dissatisfied at that time. Then waiting you go say now about 2021. If 2018 you've been dissatisfied. Eh? This make I remind the president again. He said, on the deplorable state of the health facilities, that's a cottage. He said, I am not pleased with what I seen at this place. Usai, we mamade, they can born picking them. Enough fine at all. I don't hear boku tin them about this place. So now I make myself decide for can see for myself. This facility enough fine for woman then self where the can deliver. I don't see. And now the government in business for say they improve this hospital and help for save the lives of the people them where they can at this hospital. And then you been say 2018. 2022 you don't hear? What's another? And not to the what more. The tools them where the doctors they need in all day. The last time you say water na life. We don't play an aya. The other time for that lockdown we say you see them picking them. When them picking them, they go up and down, then tote 5 gallon rubber and then aid them. They say not picking not supposed for the live so. For born the picking no, na struggle for the mama and the picking. The picking born no. Before he reach the age of 5, na struggle, na miracle. I remember the other time for that oxygen. Who asked the question? Some people were like, oh, I go ask that kind of question there. Because if na of course for bonus alone. What's going on? We'll still ask the question back today. This man they ask if the politicians then are Sierra Leoneans them. Or don't learn the president in table. Somebody be ask if then they listen. Yeah, then they listen. But they take we for granted. Yeah? They take we for granted. Una continue. Even the souls them of the one they wait for survive, we're not able to make them can of this world. Then go count against Tuna. Then go weep against Tuna. The souls them of the belly woman, the way they go, where they supposed for make them. Where that thing they not supposed for even kill them. They don't forget that kind of infection there. But because of what Tuna they do to them, it go continue for count against Una. Again, I go remind we na. Una show me the politicians, the presidents in salon. We don't done in time and enjoy them at the end of the day. We will all go be glad to say, look they go. What show me the way we just come out to? No worry. That would go down the road no more. Yeah? Now then you say your work shall follow you. Una allow the watch. Yeah? Show me. The way done. To the time of in death, you see everybody will, like when they say that one man shock, oh wow, but this man will be there. When they say your work shall follow you, they know they understand. Kill innocent picking there, they know they understand. But the woman they don't know for die, they know they understand. They know they understand. But think you say, time go fit clock. And you know they far. Time go fit clock na. So I think be say our own time will come. And don't the road true. And time become. And in saloon, we chef yon team. You go come. By God power. Yeah? I continue no more. Not just the do it with you, not the do it. When I tell we B, when I give we C. I continue, yeah? Okay.